Hi, my name is Nathan, and the pathology disease I chose to research was colon cancer. Some background info on colon cancer. It is defined as a disease where malignant cell growth occurs along the epithelial lining of the colon tissue. It is the third most common cancer and the third leading cause of cancer-related deaths in the United States. There's actually 5 stages of colon cancer. You can see in this image up here, all the tissues of the colon are outlined. Stage 0 and Stage 1 is where they find abnormal cell growth along the mucosa or mucosal membrane. Stage 2, the cancer is kind of progressed into the submucosa, maybe the muscle layer, and maybe other spots along the colon itself past the initial site. Stage 3, it's progressed into the serosa or outer layer. Nearby lymph nodes and other blood vessels may be affected. And then Stage 4, the final stage, is where metastasis usually occurs and other lymph nodes, organs, or tissues outside of the colon and around the body itself are beginning to be affected. Primarily, this disease is diagnosed in those above age 50, and men also typically have a higher chance of being diagnosed versus women. However, this disease can affect anyone regardless of age and gender. You can see in these graphs provided by the CDC, they outlined diagnosis rates between genders, and then they broke it down between ethnicity and races. You can see males have a typically higher chance of being diagnosed here. And then on their other graph, I included is the age groups by diagnosis rate. And then right here around age 45 and 50, you really see that diagnosis start to take higher rates and really kind of skyrocket as you get older. Parts of the body affected here are the gastrointestinal system, which is made up of your esophagus, your stomach, your small intestine, and your large intestine, or the colon. Then the processes here are the breakdown and absorption of nutrients of the food you intake, as well as the removal of waste from the body. So this obviously is pretty important to your normal daily functions, and cancer here, you're going to start noticing symptoms regarding your normal bowel habitus and changes along that. This can include blood in your stool, narrowing of the stool, frequent constipation or diarrhea, feeling full after bowel movements, other things such as constipation, abdominal discomfort, bloating, unexplained weight loss, fatigue, nausea, and vomiting are common symptoms, but what's critical here is to notice when these symptoms become persistent without an explanation. That's pretty much when it is key to get it checked out. Some common causes of colon cancer are a family history of colon cancer, polyps within your colon, an unhealthy diet, which includes red meats, high fats, or high calories, history of heavy smoking and alcohol use, or personal history of inflammatory bowel diseases, including ulcerative colitis and Crohn's disease. You can see in this image, this is actually a polyp that was visualized during a colonoscopy. These are pretty small, and they can typically range to be this size or a lot bigger, and it's key to note that the bigger the polyp is, the better chance it has of being cancerous, but when they get bigger, it can pretty much obstruct your entire colon passageway, and that's when you're going to start seeing those symptoms I just talked about. Diagnosis for this disease is usually made through a biopsy or removal of abnormal tissue in the colon. This can include a polyp or any other abnormal tissues. And this is done through colonoscopy, which is when a scope is inserted through your rectum and visualizes all the tissue along the entire colon. And they also can bring in tools to remove and get that tissue sample at this stage as well. Some other imaging modalities used for this are CT and MRI. They can get a visual of any polyp or abnormal cell growth along the colon and create a 3D image such as the one below. This isn't used too often because a biopsy is usually needed to confirm the cancer anyways, so they might just skip this step and go straight into the colonoscopy with biopsy. But CT and MRI are great for pre-surgery because they give a size and precise location of the abnormal cells in the colon, so the doctor can go in knowing where they need to be and have more accurate and effective info. Other imaging modalities used are general radiography. Under fluoroscopy, the barium enema exam is great for visualizing polyps or other obstructions. As you can see in this image, there's a lot going on in this colon, and the barium is helping to outline all of that. That probably wouldn't normally be able to be seen in a regular radiographic exam. Another popular one is PET scans, and they use a radioactive glucose agent referred to as fluorodeoxyglucose, or FDG. Glucose is actually used in high amounts in cancer cells versus normal cells, so this substance will actually collect around all the cancer. Can you zoom in here? So these black parts are where this substance is found and located, mostly being attracted to. So you can see along all the lower GI tract, it's pretty bad over here, but it also helps detect metastasis, in which what this modality is primarily used for, because you can see in the liver it's metastasized up there, so this glucose agent has actually gone up there too. So that's a great way to find out if the cancer is spread around the body or not. Treatments for this disease include surgery as the most common. It also depends on the stage at diagnosis, because further you are along, if it's metastasized, surgery really might not be an option anymore. But surgery can include just removing a small section of your colon and sewing the healthy tissues back together, or it can be a larger portion of the colon removed to get rid of the cancer, and a stoma will be created, or opening outside of your body for waste to pass. This process is reversible if the lower portion of your colon can heal, but if they remove too much of it, it's not really a reversible process. And then surgery is usually followed up with adjuvant therapy, or therapy which helps prevent reoccurrence, and these include radiation therapy and chemotherapy. Both of these processes include very strong substances. Chemotherapy is very strong drugs which can be pretty severe side effects. Radiation therapy is high energy X-rays being used to help prevent cancer growth, and both of these kind of help stop cell division of cancers and cell growth themselves. These are pretty common therapies used for treatment. Less common forms of treatment include radiation ablation and cryosurgery. Those are for earlier stage diagnosis. Cryosurgery is the freezing of abnormal cells to prevent growth and further division of the cancer cells, and radiation ablation is the use of an excited electrode to basically kill cancer cells when it becomes in contact with that electrode. And then two other treatments that are used are immunotherapy and targeted therapy, and these are used for late-stage diagnosis or when other treatments aren't really proven successful. Immunotherapy will use your own body's immune system to fight the cancer, specifically the PD-1 protein found on a T cell. That actually inhibits the T cell from fighting other cells in your body, but when this immunotherapy is active, it stops that function, and the T cell can actually go ahead and locate and fight back the cancer cells that are found in the body. And then targeted therapy uses different things referred to as a monoclonal antibody, which help destroy substances the cancer cells need to grow and divide it. So this can be substances they create or other substances that your body creates. So it can help and also be a little harmful to you depending on the stage and severity of your own cancer. And then the prognosis for this disease. Survival rates for colon cancer depend on when it was diagnosed. Typically with any cancer, the earlier it's diagnosed, the better your survival rate. The American Cancer Society outlined a 5-year survival rate. Basically, if the cancer is found localized, then you have a 90% chance of survival versus regional, and it kind of drops to 71%, and then distant, you're down to 14%. So the earlier the cancer is found, the better, and whether it has metastasized or stayed in the region of the initial site can also help determine prognosis. Other prevention factors include healthier diets, basically consisting of high fiber, or follow-ups that are regular. CT is popular about every 6 months after surgery for colon cancer. You get a CT just to check reoccurrence and surveillance. Other follow-ups with your doctor just to talk about further treatments that may be needed are also helpful in the prognosis of this disease.